stick with the pandemic now, and of course the vulnerability, the disaster we've seen unfold in our aged care sector. I'm joined by Patricia Sparrow, who's the CEO of Aged and Community Services. Thanks for joining us again, Patricia. We've been interested in this issue for a very long while. What we're starting to hear out of the Royal Commission is that even the council assisting the Royal Commissioner says the governments haven't been focused enough on protecting aged care facilities early enough.
Thank you for having me on, Chris, and thank you for your ongoing interest in aged care. It's really important. Look, a lot of work has been done right from the beginning of the year with aged care providers preparing, using their pandemic plans, doing a lot of work. So there has been a lot of work done. I think what it's fair to say is that there's been a lot of learning and that there's been a lot of change. We're learning more and more about the coronavirus and the situation that we've seen in Victoria, which is absolutely dreadful, but the scale of what we're seeing in Victoria has made it really difficult and has stretched the system to the limit. That's absolutely true.
We certainly don't want to underestimate the difficulties here, because the point has been made many times and it's very clear. That is, if you have ongoing community infection, then it's going to be very hard to keep it out of aged care facilities. Nonetheless, we've got to do everything we can. And in South Australia today, for instance, they've brought in a rule where you can't have staff working at one aged care centre part-time and then at another aged care centre. You're removing that propensity to spread the disease. They're also mandating masks and personal protective equipment. My question is, why wasn't that sort of rule put in place in February? That's at the very latest March. That's when we're talking about these issues, and we should have been more proactive with those rules.
I think the community transmission in Victoria has really highlighted that there are additional things that we've needed to do. That one worker, one site has been introduced in Victoria. I think it's good that South Australia have announced that today, and we would be encouraging other states to actually look at this. We've got to get on top of the situation in Victoria, but those other states that have lower community transmission really have an opportunity now to get on top and introduce some of the things that have been introduced in Victoria in the last month or so. They can get ahead of it and introduce it now, and that would include face masks, which became mandatory in July. And I think the advice about face masks, changed significantly in that period. So the other states have got an opportunity to get ahead of it, and we in Victoria have to keep focusing on making sure that we're on top of it and stop the spread, and are doing everything that we can and working with the Commonwealth and the state governments to make sure that that happens.
But my point is the frustration that in Victoria and everywhere else in this country we had the opportunity to do this earlier, because we knew back in March that it was aged care facilities and the elderly in northern Italy who were bearing the brunt. We saw in New York, of course, the bulk of that disaster was occurring by taking sick people into aged care facilities. We seem to have been slow, and it seems that the Royal Commission certainly believes that's the case.
I mean, I think that, as I'm saying, what's really happened in Victoria with the community transmission, not, agreeing with what you're saying, but I think, we had the terrible tragedies at Dorothy Henderson and Newmarch, but by and large, things were not like this. It's because of the community transmission that we find ourselves in this situation in Victoria. So I think the important thing now is for us to focus on is how we actually get on top of Victoria, and that's where we're all really focused, but also making sure that other states are learning the lessons and getting on top of that now. To your point about being ahead of it now, and where there is low community transmission, making sure we don't get in this space. One thing I did want to raise, Chris, is that part of what we think needs to happen, and that all states need to adopt, as South Australia and Queensland have, is that the first cases in residential care, the first people who are diagnosed as COVID positive, should be transferred to hospital to get the care and support that they need, but also to try and help us to stop any spread in aged care facilities. We think that's really important, and it's important for people to know that aged care is not staffed or funded like a hospital, and it's clear to us from what's been happening in Victoria and, as you say, overseas, that that's the level of care that's needed right off the bat. This is a very, very important point, and I just want to underline it with you, because again, about a month ago, South Australia said that would be their policy. If there's an infection in an aged care home, the person would go to hospital. There's been all sorts of disasters with this in New York, and there's all sorts of debate about it in Victoria. Are you saying very clearly that in all states, whenever there is a COVID infection in an aged care home, that person should be removed to a hospital for care? Particularly the first cases. So South Australia and Queensland now have that as a policy. We think the first cases are the most important because hopefully that will enable us to stop the spread.
Yep.
But we recognise that there might be instances where there is an outbreak, but it still gives us time to work with the health authorities to set up properly for a hospital in the home. And the evidence at the Royal Commission with the Dorothy Henderson Lodge showed that that's what happened. People went to hospital and they were able to set up hospital in the home, and then they did support some people later, but it was done safely and the spread had sort of been, was stopped.
Were aged care residents in Victoria who were infected with COVID-19 turned away from hospitals?
So we have had members tell us that they did send residents to hospitals and that they were sent. The Victorian is that they make decisions on a case-by-case basis about whether someone should be admitted to hospital, and we think it's really important that, as said, the first cases go. And the Victorian government have made capacity available in private hospitals and in subacute, and that's good. That expands the capacity, and we think that's even more reason why first cases should be transferred to look after that person, really importantly, but also to help us look after 100 other people and to stop the spread. But if we need to set up for hospital in the home.
Makes enormous sense. Thanks so much for sharing that with us, Patricia.
Thank you, Chris.